Autism Campaign Awareness by El Trio Fantastico. April is the National Autism Awareness Month.
Now let us meet the team members. Wafia, Putri Nur Asila and Nur Fadlina.
Now let us talk what is exactly autism means. Autism is a lifelong developmental disability that affects how a person communicates with and relates to other people.
Next, what actually causes autism? There is no one cause of autism, just as there is no one type of autism. Most cases of autism, however, appear to be caused by a combination of autism risk genes and environmental factors influencing early brain development.
Now, let us watch a video regarding on signs of autism.
How to recognize the early signs of autism. Early intervention is important for children with autism, a developmental disorder that inhibits socialization, so be on the lookout for warning signs. You will need knowledge of developmental milestones and careful attention to your baby's behavior. Optional, a hearing test for your child. Do not assume that if your baby exhibits behaviors associated with autism, they necessarily have the disorder. Observe them carefully and bring any concerns to a doctor. Step 1. Pay attention to when your baby begins to babble. They should start at around 5 months old. Step 2. Begin monitoring eye contact at around 6 to 9 months, when infants generally start smiling in response to their parents' grins. Babies with autism tend to avoid looking at their parents. Step 3. If your baby makes a sound, make one back and see if they reciprocate. Babies with autism usually do not take part in this verbal turn-taking, nor do they participate in peekaboo. Step 4. Note whether your baby responds to their name. They should begin to do so starting around 10 months. Babies with autism often ignore people trying to get their attention and don't solicit anyone else's attention. If your baby ignores you when you call their name, get their ears checked. They might have a hearing impairment. Step 5. Note their behavior around 12 months. By this point, most babies are pointing, waving, grasping objects, and attempting to speak. Step 6. Gauge your baby's sensitivity to sound and touch. Many children with autism are unusually sensitive to loud noises and hate being cuddled or touched, yet they sometimes underreact to pain. Step 7. Note their focus. Do they tend to fixate on a favorite object or part of an object, to the exclusion of other people, including other toddlers? Step 8. Look for repetitive movements associated with autism, such as rocking back and forth, hand flapping, and twirling. Step 9. See how set in their ways they are. Children with autism often exhibit strong resistance to changes in their routine. Step 10. Keep track of their vocabulary. At 18 months, most babies can say about a dozen words, and by the 2-year mark, they're usually initiating 2-word phrases. Step 11. Some children with autism seem to develop normally until 18 to 24 months, then stop or regress in speech and other growth. Consult your pediatrician if your child regresses or if they exhibit any of the behaviors previously discussed. Did you know? Canadian researchers have found that the intelligence level of people with autism spectrum disorders has been underestimated, and that many of them could excel at highly structured jobs in math, science, and law.
Now, let us see the symptoms of autism. There are 4 types of symptoms: possible red flags, communication, social skills, and unusual interests and behaviors.
For the first one, possible red flags. There are many examples, like obsessions, lack of social skills, echoing words, always playing alone, toe walking, spinning wheels or themselves, hand flapping, and also other examples.
Persons with autism may possess the following characteristics in various combinations and in varying degrees of severity, such as may avoid eye contact, may not want cuddling, difficulty in interacting with others, may prefer to be alone, and other examples.
Next, we will see unusual interests and behavior of autism. They might line up toys or other objects, like parts of objects, for example wheels. They get upset by minor changes, and they have to follow certain routines.
Communication. These are the examples. Delayed speech and language skills, repeats words or phrases over and over, reverses pronouns, gives unrelated answers to questions, does not point or respond to pointing, uses few or no gestures, talks in a flat robot-like or sing-song voice, does not understand jokes.
Now let us talk about the treatments of autism. There are 3 types of treatments that are used by specialists nowadays. And the treatments are behavioral training and management, specialized therapies, and also medicines. Now, let us watch how a real autism person in real life.
So, any questions about what we're doing here? All right.
When Tess was 3.5, we had her diagnosed with an autism spectrum disorder.
I was saying.
More specifically, it was called pervasive developmental delay, PDD.
Oh, cool. Let's go do that.
I'm Mary Beth Marsden. I'm Tess's mom.
You say I can't make any sense in this.
The biggest problem over the past couple of years since she's been in school is school.
Can you read that for me?
Alright. Explain how the test supports an important idea in the article.
Calm down. Want to take a break?
And anytime the work gets really hard, and anytime she thinks she can't master it, when she's pushed to do it, she pushes back.
Wait, why did I read that again? I've already read that.
No, I just want you to write it so I can write it on the paper for you.
Fine.
Remember-
Do I have to write it all over again?
No, just one time.
Oh, that's the dumbest thing I've ever heard.
I see Tess's biggest issue being her anxiety towards failure. My name is Sarah Kamarmi, and I am a special educator at Chatsworth.
Wow, did you hear that, Tess?
What we're doing with Tess is she's on a reinforcement break schedule.
Let's see what happens. What's the question? List 5 things you have.
I know that.
I targeted 3 behaviors that we really needed to sort of rein in.
I will listen to my teacher. I will complete my classwork. I will use the talking points.
Every 10 minutes, if she's able to do those 3 things, she gets a star. And every 3 stars, she gets to take her preferred break.
Do I have all 3 stars?
Yes, ma'am, you have earned your last star.
Yes.
I'm Toria Campbell. I'm Tess's aide. She has 3 stars at the end of the 30 minutes. She earns a 5-minute break, and she's able to choose from 7 or 8 different treats, as she calls them, treats or prizes.
Can I take my break now?
Yes, ma'am.
Yes.
5-minute break.
We're taking our first break. Follow me.
Especially for kids on the spectrum. They need to be motivated. We have to think outside the box for them.
Miss K actually wants you to do your DS right now. Just so we won't interrupt. Is that okay? All right.
Tess is not a person that's motivated by grades. She's not motivated by the social piece, which is huge for kids at her age.
You take your time, and if you get frustrated, we have to turn the game off. We'll pause it.
Whoa, that's not supposed to happen either.
That social piece, a lot of typical kids get their breaks that way. For our kids that aren't really motivated by social experience, going to lunch is more stressful than it is a pleasure.
It's a good idea.
Having breaks for our kids on the spectrum is huge.
Well, I always calm down. And my favorite break is DS.
And it keeps her motivated. I definitely believe that.
Her time in class is way up. Her overall aura when she comes to school is a lot better. She doesn't walk down the hall with a look of dread on her face. She's more excited. We made school fun.
Thank you. Thank you.
You did a great job, didn't you?
Yes, I did.
The end.
Thanks for watching.